Hello, everyone. Welcome to another podcast from The Root of the Matter. I am your host, Dr. Rachaele Carver. Today, I wanted to talk a little bit about hand diagnosis. And as a health coach, I am always thinking kind of beyond the mouth, right? Because the mouth is connected to the rest of the body. And how does the mouth affect the body and vice versa? One of the things I think that we often miss in conventional medicine is the root causes. Obviously, that's why I'm doing this podcast, to try to highlight that there's more than simple blood tests. We really need to look deeper. I mean, how many of you out there have felt terrible? Maybe you have a rash, you're feeling exhausted, list any number of symptoms, right? You go to the doctor, they do the conventional blood test, and they say, you're fine. And they dismiss you and you go on your way. And you continue to feel miserable. And you're trying to do all the right things. You think you're taking the right supplements. You think you're eating the right. You think you're exercising enough. And nothing is changing. Nothing seems to move the needle. And that's where functional medicine testing is so important. And in my practice, we do a lot of that because, right, I can look in your mouth. I can look at your tongue and see, hey, what's happening in the rest of your body. So we're going to do a podcast about tongue diagnosis as well, because that's really thrilling, really fascinating, and a way for you to kind of be your own doctor. And a lot of my mission is to try to help you. I would love to never pick up a drill ever again. We will have eradicated oral disease, and we will have made everyone their own best doctor, right? Today, you have to be your own advocate, because there's so much gaslighting that goes on, and not because physicians are bad people or they don't want to help you. Obviously, they go and they spend so much time and money in this profession to help people. But the system is really, it's preventing us from actually doing good medicine, right? It's become a business. The whole art of treating people has really gotten lost, unfortunately, since big business has come in and taken over a lot of medicine. So what I want to teach you today is things, and so functional medicine testing is fantastic, but it can get very, very expensive. So what are some other things that you can do just by looking at your body that may give you some more clues? So one of the things I found very fascinating is something that you can see on this chart. It's called Fingernail. It might be backwards if you're watching on YouTube, but it's called Fingernail and Finger Analysis Chart. And this was given to me by Roger Bezanis, Bezanis. You can go to his website. He has some really cool, a lot of cool picture books. And he's a huge proponent of raw food, which, he does great on that. I don't necessarily recommend that for everyone. But he has a lot of really great information and really good ways to try to understand your body. So what he talks about is we think of the hand, and each finger, just like we've talked about in the mouth, right? Each tooth is on a certain meridian and can be linked to other body parts. Well, the hand can also, it's hard to see, right, into our mouth and look at individual teeth, but we all can see our hands very easily. So what does he describe? So our thumb, right? The thumb is related to your colon, your intestines, and your stomach. So, for me, who had eczema on her hands, I really loved this tool because I was like, oh, right now it's on my thumb. It's not now. I've healed from my eczema, but sometimes if I get a little flare, something starts to happen, and then I look to this chart. It actually hangs on my wall in my office. So, and I look, I'd be like, okay, I think my colon needs a little extra love right now, or my liver, gallbladder, whatever it may be. So let's go over that again. So thumb, colon, intestines, and stomach. So do you have a rash in that area? Is your nail look different somehow in this area? The forefinger, okay, our pointer finger, this is liver, bladder, spleen. The last time I had a minor little breakout, this is where I felt a little roughness. I didn't get full-blown eczema, but it started to get a little dry right here. So for me, I'm always working on my liver. Always, I'm around heavy metals and all sorts of toxins all day. As much as I try to minimize that in my practice, I'm removing a lot of these amalgams of heavy metals, and I protect myself, but still around it a lot. And so I have to pay really close attention, to my liver, not to mention, I was on Accutane as a kid. I was on antibiotics. I was on birth control. So I really kind of did a number to my gut and liver. Third finger, this is heart, lungs, and respiratory system. Fourth finger, kidney, reproductive, adrenals, and overall circulation. So, do any of you have like swollen joints, right? Years and years ago, when I still had eczema, I would often wake up, and this was when I was in my mid 30s, and I felt like I had arthritis. I mean, it was terrible. And it would be specific. I think usually it was in my fourth finger, the knuckles there, right? So that's adrenals. I was probably, running on empty a lot of the time. I wasn't properly nourishing myself with enough food, enough rest. And now, I no longer have that. But for years, I had a little bit of felt like arthritis, and if a traditional doctors just say, well, it's osteoarthritis, just take some NSAIDs, and for me, like when they diagnosed my eczema and they just want me to be on steroids the rest of my life, I was like, that doesn't sound like a good idea to me, right? I want to have some immune system by the time I'm 50. And again, I've been able to reverse it. I feel like every other commercial on TV nowadays is for some skin rash. And I mean, we all laugh about it when we hear the side effects, could possibly cause a limb amputation. I mean, death seems to be common with all of them, but some of these other ones, it just sounds crazy. And I laugh and I get frustrated because, I'm like, gosh, I reversed my eczema, which was so bad. If any of you have ever seen my earlier episodes, and I maybe had some pictures. I mean, it was my whole hands. It was so uncomfortable, so itchy, so red. I couldn't give my children, baths. And I could have gone the conventional route and just been on these medications, but they didn't even, take it away completely, right? And so I had to do the deeper work. Yes, there was inflammation, but I had to really understand, okay, so my gut is leaky. How am I going to heal that, right? But then at the end of the day, it really came down to the nervous system. I was trying to do so much. My body was so stressed, right? So this knuckle, my adrenals, my cortisol was all over the place. So until I learned how to try to balance my nerve, and it's something I will be working on for the rest of my life, genetically predisposed to be that type A, go, go, go type of person. So I've had to learn, I love my eczema. It created this whole new direction. It gave me purpose in life to understand, what I'm supposed to share with the world. And it just helped me learn so much so that I can share with all of you, so you can share with all of your family and friends, so that we can all, again, be our best doctor. So let's review that hand again. Thumb is colon, intestines, stomach. Pointer finger, liver, gallbladder, spleen. Middle finger is heart, lungs, respiratory. Isn't it interesting, when we are angry at somebody, we use our middle finger, right? That's on the heart, associated with our heart, right? So it's not so good, right? I want to be nicer. Fourth finger, kidneys, reproductive system, adrenals, and circulation. And the pinky is brain and the immune system. So at one point I had eczema just down, it used to move all over the place, and one time I had it here. And I had one of my mentors, he said, oh man, your immune system is all out of whack now. Did you just get a new car? It was like the new car smell or whatever was, all the toxins, and that was really affecting my immune system. So interesting. All right, now let's look a little deeper. If the fingers are associated with certain, organs and systems, what about your nails? I want you to look really closely at your nails. Are they very, very smooth? Or do you see ridges in your nails? If you see ridges, that is a sign of improper or poor absorption of your nutrients. I talk about this all the time on the podcast, right? You may be eating a great diet, but are you actually absorbing it, right? It's not what you eat, right? We used to say you are what you eat. Really, you are what you absorb. So if you notice a lot of, and I have slight ridges, mostly on that fourth finger. And I've had some patients though, like incredibly, ridged. And so when I see that, that should be a sign to you that there's likely leaky gut, which the majority of us probably have one degree or another of some leaky gut just because of all the toxins in our environment. But with a lot of ridges there, that means you probably need some excess support. So if you have leaky gut, this is why I tend to really like liquid supplements. So a liquid mineral supplement. Most of us are not getting the minerals that we need to counteract all the toxins we're getting, for all of our body systems to have the fuel to do what they need to do. So liquid minerals, I'm a big fan. There are several different ones. You can look at Beam Minerals. I like Spectramin, Trace Minerals. I'm not affiliated with any of these companies, but these are some that I use. And I like to rotate them out. But important, because when it's a liquid, it's going to get absorbed. It doesn't have to be opened in the capsule. So many of us have low stomach acid. It's hard for us to dissolve all of those capsules. And if we do have the stomach acid, is it going to dissolve all that? How much is actually getting into circulation versus just getting passed through the GI tract? So big fan of the liquid minerals. What else can we see? So look at your fingers and we should see kind of a white half moon, right? Right at the bottom of our fingernails. And as you move across, you may notice they get smaller and smaller, and maybe you don't have any at all. So our fourth finger, our pinky, shouldn't have any moon. We should have a moon on all of them. And when I get to my fourth finger, I don't have a moon anymore. And that is a problem. That means this is a measure of how much circulation is getting through those associated organs. So like, okay, I've got one on my thumb, my first finger. I'm not seeing much on my third, fourth, and fifth fingers. So my kidneys, my reproductive, heart and lungs, my respiratory, am I not getting enough circulation in those areas? So what do I need to do, right? That's why exercise, super important. Doing some more lymph exercises. What can I do to help that circulation? Does that mean my blood might be a little bit thick? How many of you ever had your blood drawn? And it's hard, right? They're like, gosh, I can't get any blood out of here. That really, really thick blood creates a lot of stagnation, right, in the body. And therefore, we're not getting the oxygen and the nutrients to all the cells that really need it. So again, if you don't have much of a half moon, let's think about circulation. If the blood is kind of thick, then maybe taking, a baby aspirin every other day or something like that, that can improve. I know for me, it used to be really hard to take my blood. It was so thick. It was really terrible. And when I more regularly was doing digestive enzymes, because that's another way that we can really thin the blood. Why is the blood thick sometimes? We're not absorbing, we're not digesting things properly. So these large proteins are getting into circulation. With the enzymes, they help break down all these proteins in the smaller pieces so that, again, we can deliver the nutrients. So more exercise, digestive enzymes. I really like enzymes for so many reasons, helping you to digest your food. But on an empty stomach, they act kind of like Pac-Man, and they go through those blood vessels. They can chomp up. It's really helpful. Like if you do have arthritis, in our joints, we have less blood flow just naturally. And that's why a lot of toxins and things get trapped in those joints. And then we start getting inflammation because they're not supposed to be there. So the body, right, the immune system comes along, starts creating this inflammatory cascade. Again, this goes back to what I said in another podcast. The body knows what to do. It does not create disease on purpose. It is trying to create a healing cascade. And so when it sees these proteins in the joints, it creates inflammation to try to get rid of it. But if we're constantly flooding those joints with these big proteins, we're constantly going to have that inflammation. So digestive enzymes, super important. Potentially, you might need some stomach acid. So many of us have low stomach acid. Without the robust stomach acid, we don't turn on, the digestive enzymes. We don't get that bile flowing like it should. And it just kind of creates stagnation in our entire digestive system. So one really interesting test that you can do is the baking soda test. You can look this up on Google. And you take I forget the exact measurements, but you can look it up. It's like a quarter teaspoon of baking soda into some water and drink that down. If you do not burp in the first 5 minutes, that is kind of a kitschy kind of a test to see if you have enough stomach acid. Because if you do have enough stomach acid, when that baking soda, which is alkaline, hits the acid, it should create gas and make you burp, right? So that's the science behind it. So if there's no stomach acid to interact with that baking soda, then that's a sign you're not going to digest well, right? And that, as we've talked about in previous podcasts, that is the root of 90% of acid reflux. Right? It is not having too much acid, it is not having enough acid. So that's a quick little trick. Again, check online for the exact measurements there. But that's kind of another good tool that you can use. What else can we learn about our hands here? So if you have white spots in the nail beds, that can mean that there might be a hormone imbalance happening somewhere. It could, and that often can be when your body is, according to Roger, that it could be when you've ingested some toxins, and a lot of it can be dairy related. So I don't know, sometimes we We may think we have a dairy intolerance, maybe we don't know, but if you start to see white spots, maybe lay off the dairy for a few days and see what happens there. So we've learned a few things like how all of our fingers relate to different organs and organ systems. We learned about circulation by looking for the little white moons. We've learned about the ridges and our ability to absorb our nutrients. Really, really important. Also, the shape of our nails. So on the back here, if we have a nail, right? My nails, I like to keep them really short because I wear gloves, right? But if your nail, if you look at it sideways, if it flips up at the end, you might want to look for parasites, right? Most of us have parasites. We've been over this in previous podcasts. You rarely are going to find that on a stool test or, a urine test. It's certainly not a blood test. So that can be one way. Do you ever, we're about to have a full moon here, and my husband always used to get really cranky, and he finally associated with the full moon. We would call it his man PMS, right? And then when we started to learn about parasites, we're like, oh, this makes so much sense. He went on a parasite cleanse, and it was profound what he was able to get out of his body. And he no longer gets that trigger, but that's why those parasites during a full moon, they get more and more active. So that's why during a full moon, that's a great time to try to do a parasite cleanse. But anyway, so look, do your fingernails kind of fold up at the end instead of staying flat. Look for, if you have very wide, very short nails, it could be heart rhythm problems. Again, this is according to Roger. If you have a triangular shaped nail, that may indicate some weakness in your kidneys. You could have muscle and joint weakness or soreness. So you could check on those things. Again, without having to do super expensive tests, that might be like, all right, let me just do the test that if my absorption is bad, maybe I should just focus on a stool test, right? If I've got this triangular ridge, should I just focus on doing some kidney function test, something like that? So something a little different, hopefully something interesting. Please share this with anybody. And again, look up Roger's website. He has all of these cool pictograms and everything to teach you anything you want to know. So I hope you took something interesting away from today's little mini podcast, and I hope you all have a wonderful day. If you're looking for some more intense consultations with me, also, please, at the bottom of all of our notes, you'll always see a link to my calendar. And I would love to kind of help you dig into some more of these functional medicine tests. I do a lot of different ones. I love hair tests, urine tests, stool tests. There's so much that we can do to really understand what's at the root of your issue. Because once we determine the root, we remove those toxins and infections, the body just will heal itself miraculously. Have a great day, everybody. See you on the next episode.
Huge thanks to you, our amazing listeners, for helping us climb into the top 5% of podcasts in the oral health space. With all the love and support, we've been getting many requests for one-on-one consultations. So we made it happen. Are you ready to take your oral health to the next level? Click the link in the show notes to book your personalized consultation, and let's kickstart your journey to a healthier, brighter smile starting today. We'll see you then.